guys, welcome once again to Register. So today we have guests in the studio and we are going to be talking about the various methods of family planning that are available to us. And basically we have divided them into 4 categories. So first we have hormonal based methods, then we have IUDs, we have chemical methods, and also we have natural methods of contraception that you will use. So just before we start, I'll allow our visitors to introduce themselves so that you can know who you're talking to. So we are going to start from your right.
Hello, my name is Wycliffe. I'm a medical student from TKUH.
Hi everyone, Tony Kiprono is my name. I'm also a medical student at TKUH.
Hello, my name is Victor Diambo. I'm a pharmacist.
Hi, I'm Muturi Aida, medical student.
As we said, today is all about family planning. And we're going to start with the IUDs. So Peter here is going to tell us about what are IUDs, because most of us might be wondering.
So thank you, Noda, for the question. When you talk about IUD, what we mean is it's an intrauterine device. It's a long-term method of contraception. So when you talk about long-term methods of contraception, we normally have the IUD and the implants. I will not talk about the implants, either will. But then IUD are two forms. We have the hormonal IUD and the non-hormonal IUD. Hormonal IUD, from the word hormonal, comes with hormones, mostly the progesterone, but that's not really important for your knowledge. What you should know is it has hormones, and the non-hormonal, the common type that you have in our market is the copper IUD. Copper IUD is normally used for about 10 years to prevent you from getting pregnant. The hormonal types have an efficacy that goes for between 3 years and 5 years. So the question that everyone will ask is, when should they use an IUD? And when should they not use an IUD? So with me here is an eligibility criteria for contraceptive use. When you want to use any method of family planning, or you want to take up contraception, it's always advisable you go see your healthcare provider. It can be a nurse, a clinical officer, or medical officer. They'll sit down with you. They'll use these eligibility criteria to determine what best suits you. So if I was to say today that everyone is eligible for IUD, that would not be correct, because as you can see, with this will, we have very many options, and every person is suited for a specific option that the healthcare provider will determine. On IUD, I'd like to add a few things. People using IUDs normally go mostly side effect free, or in cases where they go through side effects are normally very few. The most common side effects for hormonal IUD are normally the usual headaches, a little bit of spotting in between your periods. But then those using hormonal IUD normally experience lighter bleeding during their periods. Their cramps are normally less painful, so it's a bit tolerable. But then for copper IUD, most people have always reported to their healthcare providers that they suffer from severe bleeding during their menstruation. Some have intolerable menstrual cramps, and some normally have severe headaches. So in case you experience severe bleeding, severe headaches, intolerable menstrual cramps, then you need to go back to your healthcare provider. They'll be able to use the eligibility criteria after reviewing you to decide which method best suits you.
So that's it about IUD. In case of any questions on IUD, let's leave it in the comments below so that we may have it answered. And just about the second method of contraception that you mentioned, Ida is going to tell us briefly about hormonal contraception, but majorly on the oral methods and the implant.
Okay, thank you, Anolda. So I usually say this: the best method of contraception is abstinence, but if you can't, well, we have choices. So on hormonal contraception, I will major on the pills and the implants and the injectables. There are 3 main ones. So on the pills, there are combined oral contraceptives. There are estrogen only pills and progesterone only pills. These are the pills that you take each and every day. of your cycle. That is, a normal cycle is 28 days. So you take from day 1, some will go to day 21, some will go to day 28. We'll expound more on that. Then on the implants, they are tiny devices which are put under your skin so that they release hormones in certain amounts so that they prevent you from getting pregnant. There can be progesterone only or combined estrogen and progesterone. Then there is the injectable pill, commonly known as Depo-Provera. It takes 3 months. So after every 3 months, you will have to go and get injected so that you can prevent yourself from getting pregnant. So there are wanted side effects and unwanted side effects of the hormones majorly. So the wanted side effects or benefits are less menstrual cramps. I know ladies don't like that. And the other is less flow. But again, the unwanted is you can be having intermenstrual spotting. That means you're having like a period in quotes in between your period. Little blood spots on your panty liner or your panty each and every day. But that one can be controlled. As Peter said, you can go to a healthcare provider and get checked, and you can switch, or you can also get some treatment on top of that so that it can help you control those unwanted side effects. Others are weight gain, weight loss, some maintain their weight, mood swings, but all this will be, you can discuss with your healthcare provider and they can switch you or advise you on what to do.
I'm wondering if you guys are having a whole lot of questions the way I'm having, but then now we were having, I mentioned 4 categories, we just tackled 2, so I'm going to have Wycliffe tell us briefly about natural methods of contraception.
Yeah, hello once again. So, as my colleagues have said, all various methods of contraception have various unwanted effects, and that's why we have options. And one of the options is using natural methods, which basically means you are using your body to control your probability of getting pregnant. And just to mention before we move to the next topic, we have what is called coitus interruptus, where during sexual intercourse you get to, before ejaculation you withdraw so that you don't ejaculate within the vaginal canal. Another method is called the lactation amenorrhea method, where breastfeeding women, if they breastfeed exclusively, they will not be able to get pregnant within the first 6 months of exclusive breastfeeding. Another method, another natural method is observing the safe days so that you are able to engage in insertive sexual activity only during those times of the cycle when there's zero probability for one to get pregnant. And finally, use of natural herbs. The one commonly used in our region is the Chinese concoction. And let me say, what would the major shortcoming of using natural methods is that they have very, very low efficacy of about 15%. So it is up to you and your healthcare provider to decide which is the best method you can use, because you also have to consider about the other unwanted effects from other methods of contraception. Thank you.
Wow, that's very exciting, and as usual I have lots of questions also there. But then now we are going to our fourth method of contraception, which is chemical methods, and Tony is going to elaborate on that now.
So thank you so much for the question. Chemical methods are usually not preferred more compared to the other methods that have been said by my colleagues. And for an example, we have the spermicides, condoms that are lined with spermicides, and this is usually least preferred because at times it can have side effects on your own body, where we have allergic reactions and also hypersensitivity. And research has also shown that it predisposes one to UTI, and that is why perhaps it is not usually preferred. So that is what I had to say. Thank you.
Can I use spermicides exclusively without any other method?
So thank you once again. I want to help my colleague. One thing about the use of chemical methods of contraception, as my colleague has said, one is that they have consistent adverse effects, like the hypersensitivity and the allergic reactions. Two, they have very, very low efficacy of about 5 to 10%. So it is recommended that you use in combination with other methods of contraception, especially the use of barrier methods like condoms. Two, there are other types of chemicals that you can use. As he said, there are those condoms that have been made with the spermicides. Also, we have things, a cream preparation of a spermicide that ladies usually apply before sexual intercourse, and it is usually more effective. So the only concern here is that they have low efficacy, and they're usually used in combination for the same reason, to increase the chances of not getting pregnant.
Thank you, Wycliffe, for that. So now we're going to take a short break, after which our discussion will continue. So since I have a pharmacist in the studio and also doctors in the making, I'm going to take this opportunity to tackle some myths that we have in the society about family planning methods that are very common amongst us. So this one is just going to be open-ended for anyone who can manage to answer it for us specifically. There is a myth about when I use family planning methods, I will get infertile or I want to be able to get pregnant. So how true is that? Maybe we'll start with Aida and hear your view, then we'll go all the way.
So, there are different types of infertility. There is primary infertility and secondary infertility. But I think in this audience, we are mostly about primary infertility, which you've never gotten pregnant or you have never, that is conceived. So this is the worrying one. So yeah, there are myths about infertility. The thing that happens is after the stop of the use of the family planning method, you can have a period of, let's say, infertility before your body gets back to its normal cycle, to its normal, to its normal way of doing things. So one can take 3 months, others a year, but there are methods in which when you remove the family planning method, you immediately get pregnant if you are on ovulation date.
Yes, so to add on what Aida is saying, so what family planning does basically is delay your fertility, especially the implants and the 3 months injection. Studies have shown that the 3 months injection can delay your fertility with as much as 1 year. But then family planning methods like the use of IUD will not delay your fertility. Actually, if you remove the IUD coil, you can conceive after 24 hours as soon as it's removed. So really, like Ananda said, it's a myth, it's not true. What family planning does is just delay your fertility. So until the effects of those hormones wear off your body, until you get rid of the hormones from your body, you cannot get fertile. But then once those hormones are all out, which varies with a person and also varies with the type of contraception you're using, then you can get back to ovulating and you can get back to conceiving.
I want to add something else. So basically what my colleagues have just said is most people believe that family planning causes infertility. But which family planning method? Mostly it's the hormonal types. And by which mechanism? Because once you give an hormone into the body, you are disrupting the normal physiology, the normal functioning of the body. So once you stop using an hormonal method of contraception, your body needs to readjust, to realign its physiology in preparation for fertilization and implantation. So if you look at the various methods of family planning, the one that's a culprit is the bupropion, the injectable pill. It has a variable period from which one can recover before they conceive. It can be after you stop it, you can conceive immediately, and then you can wait before you conceive. As per my experience and practice, the longest I've seen is up to 8 months, between 8 months and 12 months. So it is not true that hormonal contraception causes infertility. It only does delay the duration or the time to which someone can conceive. And if you look at other methods of family planning like the IUCD, hormone based, after 12 years of contraception, immediately you cease or you remove the IUCD, you can get pregnant immediately. So it is good to understand that hormone contraception extend or delay the contraception, but not cause infertility. Thank you.
Okay, then in the course of interaction with people, we realized the other day I was talking to a friend and she mentioned, okay, like most people are not sure whether UTI can be caused by having sexual intercourse with someone. So since we are talking about family planning methods, I also thought of asking if it's true if I have sex with someone, unprotected one, because this one unprotected, that means I don't use barrier. Okay, barrier methods are the ones that protect us against STIs. So many people believe that when I do unprotected sex, I'll only get STI, but then UTI is out of the question. So I'd like for you to help me answer that, and also if using various methods of contraception will predispose me to getting UTI. So I'll just start with Tony. Here you have you.
Okay, thank you so much for the question. That is part of the misconception that the public has concerning the UTIs, the contraceptives, leading to the predisposition of UTI. UTI is urinary tract infection. For those who do not know the initials, in nature we have women tend to get predisposed to UTI because they have a shorter urethra, and once these contraceptives are applied to their body, especially the hormone contraceptives, they tend to predispose one to UTI. And also the practices before and after the sex, the hygiene practices can also lead to one having a UTI. But this is not to inform you that the contraceptives have predisposes one to UTI, but that is on the lower limit. I could give an opportunity to my colleagues to answer, to give their opinions.
So once you're not using a barrier method, that is a condom, you are more predisposed to getting a urinary tract infection and a sexually transmitted infection compared to one who uses a barrier method, that is a condom. So what happens is women are the ones who are affected more. Why? Because the path that is called the urethra between your urinary bladder to the outside is shorter than the males. So infections getting in there they have like a shorter road compared to the males. The culprit, as you said, is the contraceptive use, or the hormonal contraceptive use. Why? Because they make the natural hormones will protect a woman from getting these infections. There are bacteria there which are good, but then once you tip it off by maybe a lot of hormones or little hormones, you're at a higher risk of getting the infections.
Any additions?
One more thing on what my two colleagues have said is, when you're using these methods of contraception, the standard hygiene practices should be kept. That's with or without sex, and before and after sex, the standard hygiene practices should be kept. The moment you don't do that, with or without the contraception, you definitely increase your risk of getting a urinary tract infection. That aside, so methods of contraception like IUD normally has strings that are normally left by the healthcare provider so that they can be able to retrieve it when you decide to remove the IUD. So these strings give a path for the bacteria, the fungi to colonize your reproductive organs, and that will increase your risk definitely of acquiring urinary tract infections, getting sexually transmitted infections into your reproductive system. So generally the risk is there with IUD because of that specific reason.
Thank you, Peter, for that. And I hope you found this information helpful. Stay tuned for part 2 on the same discussion.